Welcome to the webinar Enhancing HPV Vaccination with Oral Health Professionals. I'm Dr. Sharon Perlman and have the honor of welcoming all of you. I know how hectic your schedule is, and thank you for prioritizing your time with us. By educating our patients and the communities we serve, we have the power to prevent cancer by promoting vaccinations. It's much easier and more rewarding to prevent oropharyngeal cancer than to treat the devastating symptoms that our patients with this horrific disease suffer. So, as oral health professionals, we not only save teeth, we save lives. We've a packed agenda today. In just a minute, we will hear from Dr. Megan Cloyd, who will walk us through the new action guide for oral health professionals. We will then hear two case studies and how this guide can be implemented from Dr. Brianna Hiller and Debbie Chalmers. Following this, we'll have time to answer questions during a panel moderated by Dr. Shilpa Naval. And lastly, we will get some helpful links and resources from Christina Turpin to wrap us up. I do want to share a few quick reminders. The session is being recorded and will be posted on the American Cancer Society HPV Vaccination Roundtable website after the session. We encourage you to use the chat for reactions, encouragement, and fun emojis, and the Q&A box for all questions for speakers. I would now like to hand it over to Dr. Megan Cloyd to walk us through the new action guide for oral health professionals. Dr. Cloyd's bio is on the screen and in chat for your review. Thank you and welcome, Dr. Cloyd.
Thank you so much, Dr. Perlman, and hi, everyone. I have the distinct pleasure today of walking you through this action guide for oral health professionals. I would like to start by thanking the American Cancer Society and everyone who collaborated on this work. Next slide, please. We have our acknowledgements up here, and I would really like to thank the team who worked tirelessly on this resource. The interprofessional collaboration that went into developing this guide was impressive and made for a very comprehensive yet user-friendly resource, and I am proud to be part of this HPV Vaccination Roundtable team. Next slide, please. So the action guide in total is just 13 pages long, and if you don't include the cover, references, and acknowledgements, it's only 9 pages. So it's quite a compact guide that is packed with great information. You can download it as a PDF, and I also recommend printing it in color just so it's available to you easily anytime you might need it. The first couple of pages of the guide describe the most important background aspects of HPV vaccination and cancer prevention. We also provide simplified action items for oral health professionals to contribute to increasing vaccination rates. Next slide. The following pages delve deeper into provider education about HPV and oropharyngeal cancer, including high-risk sites and a list of signs, symptoms, and risk factors for oropharyngeal cancer. I strongly recommend that you take a look at this list and consider adding some or all of these questions to your medical history form. This is one of the easiest ways to open opportunities to converse with patients, not just to recommend the vaccine, but also for more comprehensive screening for disease such as oropharyngeal cancer and other lesions. Next slide. The next pages discuss the action steps that oral health providers can take in greater detail. So if you already feel fully confident in your knowledge of HPV and HPV prevention via vaccination, you can skip ahead to page 5 to learn how to move to action. This includes things like talking with parents or guardians about vaccinating their children for HPV, providing a strong vaccine recommendation, and how to thoroughly screen for oropharyngeal cancer. Woven into this guide are also many links and additional resources. Next slide, thank you. So we also share how to refer a patient for an HPV vaccine, since most oral health professionals across the US are unable to directly administer the vaccine due to scope of practice restrictions and or lack of clinical workflow and capacity. This is a very important step that shouldn't be overlooked, and everything we can do to be able to link our patients with care to ultimately become vaccinated is the ultimate goal. Next slide. So page 8 of the guide discusses how to incorporate these actions into existing workflows for the biggest impact with the least amount of effort and barriers, including how to harness the power of your electronic health record. Here we go through multiple opportunities that you can create to enhance HPV vaccination counseling. We talk about various interventions, which I love because while, of course, we would love for everyone to comprehensively incorporate all of this into their practice, you can really pick and choose from this action guide of what fits your practice best and what you might want to start with to feel out and see how things go. Next slide, please. Last but not least, we have our resource center, which is really amazing and comprehensive. And I cannot emphasize enough how much we hope you click into these additional resources that have been developed by many of our partners and colleagues throughout the United States. We also have relevant CDT codes, which a lot of people don't know about. So we have this reference here and it is fully updated. So these codes include immunization counseling. So I think that is probably the one that oral health professionals are not aware of. So if you provide HPV counseling to patients, there is a CDT code for that. There are also 3 separate CDT codes for vaccine administration. So if you live in a state where you are able to legally vaccinate individuals for the HPV, you have 3 CDT codes that can be used as well. And then we also included here our code for tobacco counseling and counseling for control of adverse oral, behavioral, and systemic health effects that are associated with high risk substance use. So these should hopefully provide a useful reference for you as well. Okay, next slide. Great. So that was your overview of the action guide, and we'll talk more about some of those aspects later. But right now, I will turn things over to Dr. Brianna Hillier, who will present a case study. Her bio is on the screen and will also be posted in the chat. Thank you so much for listening.
Good morning, good afternoon. As you can see, this is Dr. Brianna Hillier. I look exactly the same as this lovely picture, so no judgment there. So I'm going to talk about case studies a little bit and how we're implementing immunization into our dental programming. Go ahead, next slide, please. So this is a statistic from COVID. This is kind of how we kind of got this ball rolling of, several children missing routine vaccinations, not just HPV. And so we watched at my health center, so our numbers dwindle like a lot of us did. And so we tried to kind of think literally outside the box, outside of the medical clinic on how we can vaccinate our patients. So I'm going to show you how we kind of came about this idea. Go ahead, next slide, please. So again, same thing, implement a creative idea, thinking outside the box. Go ahead. So this is where I'm located. I'm in Southeast Arizona. We call this our square of the map. I share a 100-mile border with Mexico and New Mexico. And this is me during COVID. So in Arizona, dental professionals cannot vaccinate anybody except during COVID, when we know a lot of us were able to be or eligible to be immunizers. So this is me with one of our clinical pharmacists, and we are at a chili factory in our corner of the state, and I am giving COVID vaccines. So it was very cool. So next slide, please. Had this idea, and I thought, well, what if we can bring this a little more further? And I had the idea, brought it to my C-suite. They were very receptive to it. Go ahead, next slide, please. And the idea was to see if we could bring dental vaccinations into our vaccinations into our dental clinic. So next slide again, this is just an overview and a timeline. So I just wanted to show this slide. This is obviously several years old, but this is just to show that this idea was a marathon and not a sprint. So in 2022, I had this idea, a year after COVID, everyone's getting vaccinated for COVID. Could we vaccinate in our dental clinic? And the first question we had was there any interest? And so we actually did a survey for every patient that came into our busiest dental clinic. And it was just a 5-question on a tablet. We asked the patient, we asked parents of the patient, family members. So we wanted to gauge interest, and there was enough interest. And so you can see in September of 2022, we actually hired an LPN. And again, in Arizona, we had to hire an LPN specifically for this site because in Arizona, a medical assistant has to be directly supervised by a medical provider. And in this dental clinic, there is no medical provider. We have a provider on campus, but we don't have one in that building. So this particular instance was an LPN. And then you can just see we started rolling this out, vaccines for children applications, all that fun stuff, lots of hurdles. Next slide, please. So this is the results of the survey where we determined, yes, in fact, at least half of the patients that walked into the clinic would be interested in getting this vaccine. And this was less than 6 months worth of a survey. So a lot of information, we were able to use that and then go forward with it. Go ahead, please, next slide. So for those who don't know, this is an AccuVax machine. My dentist brain calls it like a vaccine vending machine. It's refrigerated, it talks to your EHR, you send a message to it saying like, okay, Brianna's here, she's getting her flu shot. It figures out the right dosage, and it cross-references that with your electronic health record. And so then it logs it into electronic health record. It includes lot numbers, expiration dates, et cetera. To the right here, this is actually our dental clinic. There used to be a dental chair here, and I originally had the immunization nurse vaccinating in the dental chair, and she begged us for a traditional medical table because that's what they're used to. And I was like, it's fine, it's a chair, just do it in the dental op. And she was like, no, I'm gonna break your chair. Like, so we made, my whole joke here is we made our immunization specialist happy because she got her medical table and she's able to just administer the vaccine right there. The clinic is then down the hallway, the dental clinic. Next slide. So these are our immunization specialists. So this is Kim on the left. She's actually the LPN we hired. We actually received several grants for her because this was an innovative idea. Delta Dental of Arizona Foundation funded it. We had a lot of other private grant funders. But this kiddo is literally getting his HPV vaccine, his second dose in the dental chair. He just took his x-rays. He's here for a checkup and cleaning. And while they're processing the x-rays, he's getting his vaccine because he's right there. He's old enough. He doesn't, he was fine with it. It doesn't, this type of day, this didn't interfere with our workflow chair side very much. But go ahead, next slide, please. So these are just some numbers off the top in the very beginning. When we started this program, these are our pediatric rates. So we do offer vaccines to adults and kids, but I wanted to highlight here our pediatric focus. This was during flu season in 2023, but you can see here HPV was the second most common vaccination given in our Douglas clinic. That's down on the border. And then Sierra Vista followed suit pretty closely as well. Those immunization nurses are crossing these patients. So the patients are on my schedule, they're scouting the schedule, and then they're crossing their current vaccination record in their EHR with the state's vaccination records, because you might have gotten your flu shot at Walgreens or the local grocery store. And so they're crossing that. And then upon check-in, if they don't have that flu shot, the second HPV, et cetera, they're offering it at the time of check-in. So all of these patients were due for these. So Men-B is a really popular one as well because they forget to get the other dose. Next slide, please. These are just some ideas that we had for not advertising, but actually making it known in our clinics, throughout our clinics, that we are offering these services. Next slide. This is a flyer that we handed out. It's like a little folded pamphlet. We're giving it in goodie bags. The kids are getting it in their medical checkups. Next slide, please. These are posters that we had printed throughout our clinic. So again, we're down by the border, a lot of Spanish speaking. So this was just some ideas we had to get the word out and start having the conversation. Next slide. So I don't know, this is a little backwards for me. I don't know why I did that, but these are to date the number of each dose that we have given. So you can see we've done 139 first doses, and those are per site. So we've got our Sierra Vista pediatric clinic, we've got a GRC pediatric clinic, and then we have adult, because we do have some 18, 19, 20-year-olds that are starting their HPV vaccination series, which is great. So I wanted to show you guys that too as well. Next slide, please. This is patients' ages at the time of vaccination. So again, this is to date since we started this idea, almost 2 years now. But you can see we're getting a ton of the kiddos at 9 and 10. And this is in our dental clinic. These are not vaccines that were given in the medical clinic. This is specifically in our dental clinic. And what I want to highlight here is we are really focusing on that 9-year-old age. The conversation with the patient and the parent is a lot less, I don't want to say taboo, but parents are significantly less hesitant to start the vaccination series at 9 years old than they are if the patient gets a little bit older. We can obviously go down to the rabbit hole as to why that is, but we are offering it at 9 as recommended, and it's doing very well for us. Next slide, please. That's it. Again, this is one of our vaccinations outside in our outreach program, but yeah, I thank you for your time today, and I can hand the mic over to Debbie Chalmers.
Hello, thank you so much. I'm Debbie Chalmers. I have the pleasure to give the second case study. Next slide, please. And this is the best practices for the dental professionals in HPV vaccination education and recommendation. This is what I do during practice and using the HPV Dental Action Guide. So these are 5 actions to take to increase HPV vaccination and education into the dental practice. Is education using clear, simple messaging, integrating into your workflow for every day, creating and establishing referral pathways, and having resources for both the patient and the provider. Next slide, please. Education, I think, is one of the most important actions to take when integrating the HPV vaccination education and recommendation into your everyday. Educate the whole team on the essential HPV and HPV vaccine information. You find that you're more confident with more education that you have. Connecting HPV and oropharyngeal cancer is a cancer prevention. The vaccine starting at age 9 prior to exposure, and train how to initiate HPV vaccination conversations, and ways that you can get more education about HPV and vaccination education is CEs, online courses, and the awesome resources that we have that are referenced in the Dental Action Guide. Next slide, please. This is one through the Maine Medical Association's Center for Quality Improvement. They have a learning lab. This one is dental focused for dental providers. And this gives, the basic knowledge about the human papillomavirus, oral cancer, emphasizing the importance of HPV vaccination in preventing cancers. And it's, again, designed for dental professionals. So a lot of information, or some continuing education classes may be more medical focused, but again, this is us dental professional focus. Next slide, please. The second action is using clear, simple messaging, and patients and parents tend to respond well to discussions that are age-appropriate conversation starters, which are short, science-based. It's really important if, like this picture on the right-hand side, this is from the Dental Action Guide. It gives you scripts or talking points. And one that's really important that I really liked is the guidelines. using that scientific base that the American Academy of Pediatrics recommends that kids get the HPV vaccine starting at age 9 to prevent cancers. Again, these are just starters for your conversation with the parents or guardians of your patients. A strong HPV vaccination recommendation would have 3 key elements: highlighting the importance of on-time vaccination for cancer prevention, emphasizing the need to complete the vaccination series, not just having one during a 2-dose series or 2 doses and needing a 3-dose series. And what would be best is ending with a referral or the administration of the vaccine. Next slide, please. The third action would be integrating into your workflow. So what they had talked about before is adding a question about HPV vaccination on a medical history. So you could add, has your child been vaccinated against HPV? Has your child completed the HPV vaccination series? If not, how many HPV vaccines have they had and when were they administered? Also, during our appointment, during the flow, that great incorporation would be into your intro or extraoral exam. We're doing this on every patient at every appointment. We're assessing all tissues. So what I like to do is during the exam, I'll ask them, any hoarseness or any lumps, bumps, sore spots, cheeks, lips, tongue that you've noticed, any of the symptoms for oral cancer. That can also spark a discussion because the patient could be asking, why are you asking me things? Are these particular symptoms or signs? And discuss what you're looking for. Any type of lesions that are red or red and white lesions. And at the end of the appointment, I do like to add a short note into my clinical notes saying where we left off or where to follow up for the next appointment. If I had Johnny's parents, that I would be asking, oh, if I referred, did you follow up with the pediatrician? This comes to the next action is a referral pathway. It can be either written or verbal. Team Maureen has a great printed RX pad that you can give to the parent recommending HPV vaccination. If you're in an FQHC or federally qualified health center, you could develop a process for same-day vaccinations. And if there's no PCP, you could share a written paper that gives any local providers for the patient that doesn't have a PCP, and verbally just encouraging the patient to follow up with their doctor or pediatrician. Next slide, please. Resources is really important as well with education because this can be a conversation starter where you could have some of these posters or flyers up into your operatory where, as the child's getting their, their prophylaxis, that they can look and the parent will be like, oh, it's at age 9. Oh, my child is going to be 9 soon. Maybe I'll ask with my primary care, or why is it important? And that's when you can talk about the connection between the HPV vaccine as an oral cancer prevention tool. Next slide, please. So now we'll get into the nitty-gritty with the HPV vaccination dental project that I was a part of through the Maine Medical Association Center for Quality Improvement. Next slide, please. So the HPV vaccination dental project was a 2-year grant funded project through the Maine Cancer Foundation. We started in August of 2021 and ended in August 31st of 2023. The goal was to increase HPV vaccination rates by building pathways for medical and dental providers in Maine to work together to educate and promote HPV vaccinations for girls and boys 9 to 13 years old. The 3 areas of practices that we focused on were FQHCs, private or community dental clinics, and going into a Maine dental professional college program to discuss and educate about HPV and HPV vaccinations. Next slide. This gives a quick, I'm going to go over these couple next slides pretty quickly. The dental project structure is we had 2 medical practices that were FQHCs that participated. There were 5 dental clinics, which 2 of the dental clinics were in the FQHC. We had 2 community dental clinics and 1 private dental practice. We did baseline assessments. We looked at HPV and HPV vaccination training. And the data we collected were monthly HPV vaccination data through that was based more towards the FQHCs because we could follow the referral program. And the data points was the number of HPV conversations. Next slide, please. Here's another breakdown of the structure. So within the 2-hour training, we educated, which is one of our actions that I had previously discussed about HPV and HPV vaccinations. Workflow integration, how to add it into your everyday workflow. We created referral pathways, we reviewed talking points, and we had patient and provider resources. Next slide, please. The really great referral pathways was from one FQHC. They developed a pathway where they added a short note into their clinical notes, as well as using a non-billable code or a dummy code that you could use into your computer system. So initially they would use OCE as their code for their first conversation. OCE1, they could break it down into if the patient has had the first dose, second dose, or if they completed the series or needed the third dose, which was really interesting because the practice could run they could run the code and see how many of each to break down that information. It was actually pretty great that they just took this information and ran with it. Next question, or next slide, please. Here's an overview of our aggregate of year 1 and year 2 project results. The one piece that I want to highlight here is our HPV conversations. And the one thing that I found was really interesting is that almost 700 conversations with dental providers and medical providers, that there was no recorded pushback from any parent or guardian regarding HPV and associating it with sexual health or sexual wellness. So I know it's a little nerve-wracking to try to, where the association with HPV and cervical cancer and sexual health, where now it's a change to HPV is for cancer prevention. And it can be done. Next slide. And next slide, please. And thank you so much for having me.
Thank you, everyone, for these excellent presentations. My name is Shilpa Nawal. I am going to be your moderator for today's session. And while you get started with some of the questions and starting to kind of think about all these presentations and put them in the question and answer, let me start with one for you all. Tell me, as everybody come on the panel, great. Thanks all again. So I wanted to start us with kind of like, if you can tell us all why you have prioritized HPV vaccination in your work and what has been the motivation behind your work. Anyone? Anyone
I
can
guess
start.
I'll jump in first. In my career, I've seen a few patients that have had oral cancer, not necessarily HPV associated or related, just seeing the aftermath of what they've gone through radiation and as well as removal of the jaw. It's a tough cancer to go through. And if there's something that we can prevent this from happening, even if it's a small portion of it or one specific, HPV associated, it's why not tell everybody that they can prevent, 6 different types of cancers.
Yeah. Anybody else would like to kind of share their reasons and motivations?
Sure, I can add on really to what Debbie just said, just in that if you are someone who has had a family member or a friend with any type of cancer, if you've treated a patient with cancer, or if you yourself has gone through cancer, you know that if there was a simple and easy way to prevent cancer from happening, you would 100% wish that that could have been the case. And so That is the case with the HPV vaccine. Just as Debbie said, it prevents 6 different types of cancers, and it's so easy and simple, and that is so rare in the cancer world. We're often focused on really complex and long treatment durations, and patients have to endure a lot. So that is the simple reason why I think it's a no-brainer to promote the HPV vaccine in the work that I do.
Yeah, completely. Dr. Hillier,
Yeah.
what's your wisdom?
Yeah, to piggyback on that, same thing. I've had parents who, we talk about preventing cancer, and they're kind of flabbergasted that a vaccine exists for that. And so just even educating at that level, talking about how you don't have to smoke, right? Like those basic, things that we kind of are stereotyped into oral cancers, which obviously contribute to oral cancers, but you don't have to smoke once. You don't have to go down any bad paths, and you can end up with oral cancer. And exactly what Dr. Clayt said. It's very, I think it's a lot to go through any sickness, any disease. You're missing school, you're missing work, and so you can get the vaccine right now, no questions asked. Come back. You don't want to do it today? Come back tomorrow. Like, can we get you scheduled? There's no pressure, but again, at the end of the day, my job is to educate. I respect the decisions people make, but my job is to educate. And there's still, I think for a lot of us, there's, we think no-brainers and common things. And if I had $1 for every day someone's like, you guys have a dental clinic, so there's a lot of things we assume the world knows. And so for me, I'm like, okay, let's just step 1. Did you know there's a vaccine? And so because it didn't exist for a lot of these parents, and or they were outside the ranges, or I've also got, we see a lot of grandparents or guardians or foster parents taking care of kids these days. And that's for so many reasons. And they didn't know it existed because 60 years ago it didn't exist, 80 years ago it didn't exist. So that's where I'm at. Same page though. It's 1, 2, and you're done before you are even trying out for high school sports.
Yeah, exactly. And I know, Dr. Sharon, you have been a big advocate for HPV vaccine, so would love to hear your thoughts on this too.
Well, thank you. And just to piggyback on what everyone else is saying, cancer is life altering. Not only the emotional and the mental health aspects and the physical aspects, the day-to-day life changes. You can't have spicy foods anymore. You can't um, communicate effectively anymore. You don't feel well, and you don't feel good. And it is just absolutely draining. So if you have the ability to prevent all this, you will really make a difference in people's lives. Another aspect that I don't think has been mentioned yet is the spirit of collaboration. When we promote the HPV vaccine and we refer to other healthcare professionals, we plant the seed that oral health is important. And then they can refer back to us for dental sealants and prevention and treatment if necessary. We can promote a medical home and a dental home. If you're involved with a federally qualified healthcare center, that might be a bit easier. But if you're in a private practice or general community, this is a way to integrate oral health with overall health, and it's a win-win situation.
Exactly. Yeah. Prevention is kind of something that is so important. And this is no different than other prevention strategies that we look into in terms of sealants, fluoride, and other things. So definitely. To piggyback on this, I would like to there has been some confusion about, right, like HPV associated cancers and how oral cancers and oropharyngeal cancers. Do you guys come across these confusions or kind of patients asking, like, what are we talking about? Or is it typically a smoother conversation? And then also, while talking with patients and also while talking with other providers? How do you navigate those? And can you clarify for all our participants exactly what cancers are associated with HPV?
I can attest to working with your colleagues. So in my health center, traditionally the medical and probably most medical providers, I say this very kindly, it's hard to teach seasoned veterans new tricks. And so they are very used to, some of them, had to learn about HPV vaccination because it didn't exist when they graduated. So they've had to incorporate that change, and I appreciate that. And then a lot of them just lump it into the 11-year-old vaccination series because there's other vaccines due at that time. At 11, the parent has a lot more questions about why their child needs an HPV vaccine. And they're not thinking oral cancer. And so for me, that's why I love showing that graphic, is at 9, that parent, it's really not on the radar. And I want to knock on wood because I have not had a parent have that conversation, the stigma associated with HPV related cancers being more like STIs. And so the 9-year-old, that conversation does not come up. And I'm trying to work and show this data to my medical colleagues who I lean on every single day, but showing them, look at 9 years old, what we can accomplish. And so again, that seasoned veteran is just like, oh, you're here for your 9-year-old, well, check, bye, see you later. They're not. So that for me is working with my colleagues to incorporate the HPV vaccine into the 9-year-old well child visit instead of the 11-year-old. And that's definitely a hurdle. I don't get so much resistance as much as, oh, they'll get it at 11. So they're not anti, but they kind of think, why would we poke the 9-year-old? They don't need anything. And so I appreciate working with my team and showing them this information because, again, seasoned veteran can be very hard.
Yeah.
Dr. Duval, you raised such an important question. I think there's a lot of confusion between oral cancer and oropharyngeal cancer. And the reality is we don't have the ability to identify oropharyngeal cancer at the earliest stage possible because it presents in the little crypts and we can't see it. So by the time when we're doing a head and neck exam, it's at an advanced stage. And generally, a patient might identify it, I feel this lump while I was shaving, or some vague symptoms. And sometimes there are absolutely no symptoms whatsoever. So if we do identify it, we have to communicate that they need to follow up with professionals, but it is at an advanced stage. And the only way we can really prevent it is through the vaccination, which is another reason it is so critical because it has devastating effects. Now, we can talk about oral cancer and oropharyngeal cancer because there are so many different aspects of it, and we want to engage people to be proactive and focus on these aspects. But we do want to be very clear that we can't see oropharyngeal cancer at an early stage. And too often people confuse them. So thank you for raising that.
So there's another question in the chat. Please keep coming your questions in the question and answer box, and I'm also looking at the chat. So somebody is asking that in this current age of strong anti-vax movement, are there any negatives or side effects of vaccine that we should be aware of or should have answer for if the patients come asking?
There have been countless studies on this, and the side effects are so minimal. And we identified this in the action guide, but there might be a little bit of swelling. Some teenagers may have a reaction, an emotional reaction to getting a shot, and they could pass out. But that has nothing, no serious consequence of the vaccination in itself. we need to stick with the science. We also have to recognize that there's so much media, so much social media, and parents want to do the best for their children. And we want to acknowledge that they raise this question, compliment them for having that concern, and then provide clear, concrete, scientific answers to those questions. So we don't want to be a know-it-all or dismiss their concerns. It's important to effectively communicate with them.
Yeah, definitely. And science kind of backing with the science, getting with the studies and findings that we know. And somebody in the chat also shared that there were 9.2 million vaccination done, but the adverse effect reports were minimal, which is common with all vaccines, like
Right.
regular things that happen and side effects happen with the other vaccines. I would like to get some input from Debbie and Dr. Clyde also, especially as you've been, and everybody else actually. If somebody is coming to you and just getting started, what is the first thing, what is the first step that you advise them?
Sure, I can happily start on this. What I love about incorporating HPV prevention techniques into dental practice is how easy it can be to get started. So I would recommend, for example, if you're a dental provider and you're already doing oral and oropharyngeal cancer screenings as part of your clinical practice, it's so easy to just add in some questions to your medical history form about HPV vaccination status, and then some of the signs and symptoms of having an oropharyngeal cancer lesion, for example. These questions are included in the action guide, so definitely look there for those suggestions. They're very simple questions, but when you incorporate them into your existing medical history form, you no longer have to consciously think and remember to ask select patients these questions when you're already very busy, probably running between patients throughout the day. It's built in already. So that provides an opportunity for potentially the hygienist, who I think is a wonderful oral health professional to get involved in HPV prevention work, or the dentist to look at that updated medical history form and say, the patient checked off they're not vaccinated for HPV, but, we have an 11 or 12-year-old in the chair. Maybe that's an opportunity to start bringing this up. And then while you're doing, your typical exam or screening, you can simply weave that question in. So these are very, to me, easy ways to just start adding some of those things in that can feel just like a small addition to what you're already doing in practice. I also love adding some passive patient education resources in your office, because why not? Put a poster in the waiting room about HPV vaccination, or in the operatory. I also think it's a great idea to have a patient education pamphlet or informational sheet to provide parents or patients more information after you start the discussion. So maybe you're speaking with a parent and a patient who's 9 years old, you're just introducing the idea of the HPV vaccine to them for the first time. And to Dr. Hillier's point before, maybe they're not ready. They're like, okay, yeah, I'm not resistant to this, but I'm not ready for this. Giving them the information then puts the information in the parents' hands to say, okay, let me research this. This is interesting, instead of just forgetting about it, out of sight, out of mind after the appointment. So I think small actions like that can start to make a big impact, and then you as a provider can start to get a feel for, okay, well, how are my patients receiving this information, and then you can take it from there.
That's great advice. Anybody would like to add to it, Debbie?
Yeah, Dr. Megan, that wonderful. You hit all the points that I wanted to kind of bring up too. Again, it's just things that you're already doing and adding it seamlessly, small bits into your everyday practice. I know when I first started out, I was a little nervous to initiate conversations because I felt like I had to be an expert in the HPV, what the virus is, and in HPV vaccines. You do not have to be an expert in either of them. Just get a good solid foundation of education Like in Maine, the dentists are not, in their scope of practice, they're not able to administer the HPV vaccine. So having that strong referral system or that referral pathway as well is very important, because you're encouraging, you build your confidence with that essential knowledge. You're asking these questions, and if a parent asks you again, you can just have that referral pathway where they can find that information and who they can talk to, which would be their primary care and their pediatrician.
Excellent.
Yeah, and so we were talking about, like, if they're not ready today, I think we all know it's hard to get a patient back, once they're gone. And so we are switching to less open-ended verbiage, and just in the sense of, how about I get you scheduled next week, or how about I get you scheduled next month, or how about we get you here, so they've got that appointment on the calendar at least. People are busy, parents are busy, life happens. And so we try to get the appointment at least scheduled if they haven't done it that day. We always schedule the second dose and or third dose as needed. They are on the books. They do not leave that day. Basically, they don't leave without the appointment. And so, again, being not trying to be harassing about it, and we ask every appointment. So some of these kids, they come in for multiple visits. We're doing, 4 quads of dentistry, and we're asking every time. And I originally felt like, oh, I don't know if we should do that. Like, we're harassing the patients. And I didn't want to get, my front desk is, taking the brunt of it. Right. And so, but when I talked with the grant writers, and I mean, we have a grant writer who was with us, she's a pediatrician by training. And she's like, and for all the reasons we've mentioned today, they might have said no this week, and then their grandma got cancer. So they're like, no, yep, next week I'm getting it. Like, it just takes a bump. And that's a lot of these vaccines, right? We knew somebody who didn't, and so we ask every time, and they can, politely decline, and they do. But we have some that are like, yeah, you know what, okay. And we've had some who say, we got to go eat lunch, we'll be back, and we're like, oh man. And then they come in the door. They go and get lunch and they come back. So one person makes a difference. And so one vaccination makes a huge difference, especially for all of us that are, this is innovative. These are great ideas. And 5 years ago, 10 years ago, these patients weren't like, this was just one less person getting vaccinated. So, and I was going to just shout out people in the chat that are adding in some resources, because it's really cool. It's great to see that there's a wealth of information out there that we can all share.
Yeah, exactly.
And our job is to plant the seed. Behavior change often takes many, many attempts. So if we plant the seed and then they hear it from their medical health professionals, eventually we will get that score. I want to also mention, Debbie mentioned the concern about not being that expert. We're not experts in every single thing that we discuss. And it's okay to say, you know what, that's a great question. Let me get back to you about that. I just don't know, but let's learn together. You initially asked, what is the first step that you can do besides practicing and, of course, reading the materials that we're sharing and that are being shared in the chat? Identify someone you can channel that has had cancer and use that as your why. Use that person to be passionate about this, and you will be more effective.
Yeah, finding champions and kind of being that model definitely, I think, has seen much more success. And all the steps that you guys discussed are really some really small, like putting a pamphlet or putting up something in your office just allows the conversation to flow. Even somebody kind of seeing it and saying, I saw this, what is it? And can you tell me more about it? That is your cue to get in and say, here it is. And so yeah, excellent points. And definitely the guide has a whole set of resources along with all the folks that are sharing here. So please take a look at that, and you'll find really, again, not needing to be expert in everything, but knowing where to find what is equally important. And so there are tons of resources. Um, A question for you, Dr. Hillier. Michael is asking, is the dental immunization project in Arizona with the LPN still going on? And is it via grants or how is it sustaining?
Yeah, so it's definitely still ongoing. I mean, all those numbers are to date, like as of September. So we received, we were fortunate enough, so Delta Dental of Arizona Foundation, so check your local foundations, your, especially Delta Dentals, they, whether you agree with their reimbursement schedules is not the point. We ended up not lucking out, but they had a whole board shift. New members came onto their board and they were looking for, yes, we want goodie bags. Yes, let's do screenings and sealants and fluoride, like total prevention, like that's still there. But they were looking, their board started to resemble more of a whole body and whole health aspect. And I was like, do I have an idea for you? And so they loved it and they funded this position along with another one. Our immunization coordinator, she's speaking left and right, she's getting awards. It's a really cool thing. So, there's sites like, AAPD might be something to consider, the American Academy of Pediatric Dentistry. There are, again, we did Delta Dental. We have another smaller funder that's local, but it's still definitely ongoing. And our goal is for it to be self-sustaining eventually, right? But it's definitely being funded. It's an innovative idea. One of the sites has an MA, and that's a lot more affordable. But the MA this clinic is stationed, like they're co-located together. So there is a medical professional in the building so the MA can administer the vaccines. So it's the same concept, an immunization specialist, it's just a different title and that's again, based on your state rules.
Sounds good. Sounds good. So you guys did share a little bit about how to get started, how somebody can kind of like how you have addressed question. I'm wondering if you guys have encountered any barriers. Some of them were shared like patient not coming and kind of letting them go with the information, things like that. But any barriers that you have encountered and how did you take care of it or how any examples of it?
And there was a great question in the chat about how do you handle the questions about sexual activity and the information that's out there. My advice, lead with cancer prevention. Don't mention HPV all the time. Talk about the benefits of cancer prevention and refocus on that aspect and say, I am here to prevent oropharyngeal cancer. I want to make sure your child is healthy or you are healthy, and acknowledge that, yeah, there's a lot of information about that, but that's not why I am here. I want you to avoid the effects of cancer.
Absolutely. Dr. Perlman, that is spot on. And I have never had the case actually where the conversation has veered into really like focusing on HPV transmission and sexual health. But if it did, I would imagine that a way to potentially turn the conversation around would be to emphasize that the HPV vaccine is for everybody and has nothing to do with your sexual promiscuity or anything of that. It's something that almost every single person will come into contact with over their lifetime, and then steer the conversation back to cancer prevention. And with dental providers, you can so easily steer that back specifically to oropharyngeal cancer prevention. And I think, when you're a dental provider, you're focusing on your area of expertise of the mouth. You can simply say, listen, this vaccine is very effective at preventing HPV, which causes oropharyngeal cancer. And that's what I care about for my patients. And then sometimes if the conversation really takes a turn, again, never happened to me, but is in the realm of possibility, you can always table that conversation for another day, right? You can say, I'm sensing you're uncomfortable with this, and that is totally fine. There's no pressure. but it's my job as your doctor to provide you the knowledge that I have and share it with you. And then that's another opportunity. Hey, would you like this pamphlet? It has some more info. You can totally review this in your own home, with what you're comfortable with, and take it from there.
Perfect, perfect. So I think we are at the end of our time, and it has been such an exciting and kind of engaging conversation. Thank you to all who have participated and have been engaged in this. And thank you to all our panelists today to kind of share this excellent information with us. So I am now going to hand it over to Christina Turpin to kind of share the wrap up and closing and provide you with all the resources, wonderful resources that we have. Thank you.
Great. All right, we're getting that up here. So as Shilpa said, I'm Christina Turpin. I'm a director with the National HPV Vaccination Roundtable. And I just want to say a huge thank you to our speakers, moderators, presenters, everyone today, as well as our ACS HPV RT staff, Dr. Gabby Darvall Sanders and Kiera Long, who has been running the slides and helped with so many different things. So a huge thank you to them. I'm going to go through a few quick resources and wrap up for you guys, but thank you for being here and helping us launch this amazing action guide. Next slide. So where do you find this? I put a link in the chat earlier, but if you happen to be on our website, you can see that top header there. If you go to news and events, and then you go down to initiatives and campaigns, there is a spot to click that says HPV vaccination action guides. And there you'll find the full scope of our action guides, health plans, clinicians, support staff, large practices, small practices, and then the dental health providers is also linked there as well. Next slide. We also have so many other resources. Along that top bar as well, you'll see Resource Center. If you're ever doing any work or getting any questions that you're like, I wonder what the science says, or is there a social media graphic for that I can use for my clinic? I could learn more on the announcement approach for HPV vaccination. Can I get more information on that? All of that you can find in our Resource Center there for you as well. Next slide. We also currently have an on-demand HPV vaccination dental education series, and huge thank you to our ACS staff, Ashley Locke, for engaging in this. But you can scan that QR code, or we will have the slides sent out later you can click the link there to register, but you will get 4 hours of free ADA CERP for taking these sessions. And so it's a really great course if you're thinking, okay, I have the action guide, but how do I learn more? This is a really great place to start. Next slide. And then here we also have our ACS HPV Vaccination Promising Practice series. And we have done the first 3 sessions that you can watch recordings of. And that is back on that header. If you go to where the action guides are, there's one right above that says Promising Practices series. You click there, you can find the recording slides to these previous ones. And then you can register via this QR code for session 4, which will be on November 19th. Next slide. And that is it for us today. I just want to thank everyone for joining. Please use the action guide, love the action guide, spread it around. And we're so glad that you guys are joining us for this, and we hope to see you soon. Thank you.